Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I want to talk about muscle fiber dysfunction, the progression from normal muscle tone through contracture and shortening of the muscle into hypersensitized taut bands or trigger points, because that is the general progression that we see when someone is in pain. So someone might be in acute pain or they might be in chronic pain, and they're probably somewhere along that scale. So it's helpful for knowing how to treat and what to expect from your treatment as far as how long lasting your release with the motor point will be. So let's talk first about normal muscle tone. Normal muscle tone is primarily being regulated by muscle spindles in the muscle that send information to the nervous system, especially the spine. Mostly spinal segment is going to manage that muscle tone. However, there are some subcortical activities that will also engage muscle tone. Muscle tone is used for things like posture and defying gravity and preparation for more explosive movement. So we need muscle tone. The problem can be that if you have long periods of that tonicity, that muscle tone being maintained, that can be difficult for the muscle. It can sort of burn out, and you will see increases in shortening of the muscles. Acetylcholine makes the muscles contract. ATP is very important for contraction and relaxation of the muscle. ATP is involved in both the activity of contracting, activating the muscle, and ATP is necessary for telling the muscle to go back to its normal length and stop contracting. So when you have long-term contraction and you start to lose ATP, you're going to start to see some dysfunction in the muscle where it can't release. And some of those fibers will start to stay shortened. More acetylcholine floods into the area, which makes the muscles contract and depolarize. Ischemia sets in. Without good blood flow and oxygen, you're going to have a pH change. You're going to have even less ATP. You're going to have less of the acetylcholine esterase, which is the enzyme that helps to basically clear the acetylcholine from the area. So you end up with this sort of acidic, ischemic situation that's going to cause even more contraction. And then once you have had long-term muscle shortening, you're going to see more of those fibers start to get hyper irritated. And then you have the pain chemicals set in. And CGRP, by the way, also creates more contraction of the muscle. So you get pain chemicals in the shortened muscle that become hyper irritated, and that of course causes pain. Now, muscle shortening can cause pain, but more for mechanical reasons. A shortened muscle, it means pulling on the tendons, restricted range of motion, rubbing in the joint. So muscle shortening is a contributor to joint pain or tendinitis as well. But the end problem that leads to chronic pain that can go unresolved for years is going to be the trigger points. And that's when you're going to need to use a dry needling technique to deactivate the trigger points. The increased muscle tone that can cause pain is what you're going to see that will respond to distal acupuncture, where you're just working on the fascia and relaxing the autonomic nervous system. If you take down muscle tone by relaxing the person, their low back pain, for instance, could resolve temporarily, or, if it was just an acute thing, then it might be resolved. But that's a muscle tone issue. There are known acupuncture points used for certain things like shoulder pain. So if you're doing like a stomach 38, like in the tibialis anterior area, stimulating that fascia and then having someone mobilize their shoulder, moving their arm around. If it's a muscle tone issue, a hypertonic muscle issue, they will probably feel improvement. If the underlying issue is muscle shortening and or trigger points, if they do feel some relief, it will not last, because the structural mechanical problem is still there. The shortened muscle will not release with distal acupuncture. So this is where motor points come in as the winner. Using the motor point of a shortened muscle, or a muscle with increased muscle tone, by the way, electric stimulation for 30 seconds or more will sufficiently release the shortening of the muscle. It will reset the shortened muscle to be more elastic, restore blood flow, clear inflammation, deliver ATP to the area, reduce the acidity that's being caused by the ischemia. And then also for trigger points, you'll see a temporary relief in the muscle if they have trigger points. For the same reason, you are bringing better blood flow to the healthy parts of the muscle that has a trigger point. So you'll see up to 3 or 4 days of relief for that person, but that taut band in there with the pain chemicals is still there. And you'll see over a few days that the pain will come back, because it's still an acidic environment that you only temporarily balanced out with some motor points in that muscle. And that's when you're going to need the dry needling to deactivate tight taut bands that are hyper irritated. So an example of a hypertonicity that you might not need to treat directly would be the QL, the quadratus lumborum, which you probably have heard me talk about the relationship of the psoas and the quadratus lumborum. The psoas is the huge hip flexor that's attached on the front of the lumbar spine at those transverse processes, and it pulls the spine forward when it's short. So it increases the lumbar lordosis. And as a counterbalance to that, the erectors and the QL will tighten or become hypertonic. So that tonicity is essential for maintaining the stability and safety of the lumbar spine, the spinal cord even. So that hypertonicity that you'll feel in the QL and the erectors may go away if you release the psoas. When it's not going to go away is when this has been a chronic enough issue that you now have muscle shortening in the erectors and the QL. So that's the situation where you really will want to use the motor points in the erectors and the QL, usually around the level of about L3, because that'll be right above the iliac crest. So many cases with back pain, you are treating the hypertonic erectors and the QL, and of course the gluteus medius and the piriformis, because back pain starts in the pelvis. And I've already talked about that before. And it's usually because the psoas and other hip flexors have become shortened. So the shortening of the psoas and TFL are going to, and rectus femoris as well, are going to put an anterior tilt on the pelvis, which shuts off the glutes, makes the glute max inhibited, and then the piriformis and the glute medius are working even harder. And because they are actually capable of being power muscles and stabilizers, they have enough slow twitch fibers that don't fatigue, that they are the ones that are going to become hypertonic, then shortened, then have painful trigger points. You'll see this very, very frequently. It's really rare that you'll be treating trigger points in the gluteus maximus, because it shuts off before it can ever get ischemic and full of trigger points. Now, you can have glute trigger points. They typically come from trauma to the muscle, like falling on your butt. Okay, so hypertonicity that you're going to see in things like the erectors can sometimes resolve by just releasing the psoas. But like I said, if it's long-term, there's already been some shortening, contracture of the muscle. It is now short, physiologically short, weakened by being contracted. Vladimir Yondik called it tightness weakness. So that contracture is now changing the chemical dynamics in the muscle, and it's going to become more ischemic. There's going to be hypoxia. There's going to be less ATP being delivered to the muscle cells. And with less ATP, the muscle has a harder time releasing, because ATP is part of the process of also relaxing the muscle. And then, of course, calcium can get stuck in the muscle, keeping fibers short. And you need calcium for contraction, but you also need the muscle to release and the calcium uptake in the sarcoplasmic reticulum of the muscle cells, or the sarcomeres. So it's really important to recognize at what stage you're dealing with the person who is coming in with pain. It's going to tell you a little bit more about how many sessions you may need to get them better. And of course, as you might guess, someone with trigger points needs more treatment sessions than somebody who just has a postural issue that's leading to back pain or hip pain or knee pain or whatever it is. But it's important to know that muscle fiber dysfunction is the primary cause of most musculoskeletal pain, and that's joint pain, tendonitis, just every kind of neck pain, back pain, everything you can think of. And then even the peripheral nerve entrapments are going to be influenced by hypertonic muscles that have become shortened and eventually have trigger points. All of that is the beginning of the problem that most people have with acute and chronic pain. It's the least studied thing in the medical world. They don't really want to know about it. The research is there. I'll see if I can post something that will point you in the right direction. But the research is there for muscle fiber dysfunction and the cause for most people's pain. But the medical world really doesn't want to know about it, because it would really undercut their profits. If they were examining muscles first, they would spend less time on expensive MRIs and epidurals and nerve ablation and surgeries for pain, and eventually hip or joint replacement surgeries, because unresolved muscular issues lead to a degradation of the joint that is so extreme that it doesn't make sense to not replace the joint. If we were catching muscle fiber dysfunction before it turned into extreme situations of arthritis and degradation of the soft tissue and synovial fluid, etc., we would keep so many people away from surgery, and they would be living much happier, more productive lives, because it was cut off before it got to that level. But because we ignore the role of muscle fiber dysfunction in movement and pain, we have a lot of people who are in chronic pain with no help because NSAIDs, anti-inflammatories and corticosteroids are not going to address muscle fiber dysfunction. It's not going to happen. And even massage and stretching and exercise like physical therapy do not undo most of the things that I just mentioned. The hypertonicity, yes. Stretching out your hip flexors is going to decrease muscle tone in your low back, and you will have relief. But if it's a chronic issue, because the psoas has become chronically short and shortened, contracted, without treatment with motor points, that psoas, when it's not warmed up, is at a short position that puts an anterior pelvic tilt. It's going to cause a lot of back pain, hip pain, eventually knee pain. So motor points in the muscle to reset them could make a huge, huge improvement for people with back pain, hip pain, and knee pain. But just understand the progression that we're looking at, so that you understand better how to judge how much treatment a person might need. When you're able to palpate someone's muscles and you feel the hypertonicity, but you don't have a sense that there are trigger points, then you know that that person is going to get better quickly with just motor points with some electric stimulation. What you'll notice is after you've treated all the muscles, there still may be some hypertonicity that you feel. And that's actually contracture of the muscle, because the muscle released, but not as well as you would like. And in that situation, it makes sense to do a bit of a dry needling technique, even if there's no trigger points. I'm thinking a lot about the QL. The QL doesn't have to have trigger points to be so shortened and contracted that it's causing dysfunction, a hip hike, low back pain, cluneal nerve entrapment. There's a lot of problems that the QL can cause when it's just contracted, even if you don't feel taut bands. So in that case, dry needling cross fiber for the QL can make a huge improvement that will last for low back pain. So I will do it in that case. You're going to find a lot of painful trigger points in the gluteus medius and the piriformis on someone with chronic low back pain, because those muscles were hypertonic, then shortened and contracted, and then hyper-irritated bands with pain chemicals. And that pain is not going to feel, they're not going to know that it's in their glutes unless you push on them. Most of us are not pushing on our glutes or our piriformis hard enough to even know that we have fiber dysfunction there. What we feel it as, it will be SI joint or L5 pain, because that's the direction of fibers that the piriformis and the gluteus medius take. So the pain referral is at the tendinous attachments at the sacrum and the low L5 area, not in the middle of the muscle. So knowing that will help you to help a lot of low back pain patients if you're willing to palpate and find the hypersensitized taut bands in the gluteus medius and the piriformis. It'll make a huge improvement. And by doing that, you're aiding the muscle function, because when it's hyper contracted and irritated, it's not functional. It won't stretch. People with these trigger points will have pain just sitting. They'll have pain at L5 just sitting, or they'll have pain at their sacrum just by sitting. And no amount of SI joint injections or epidural injections at L5, S1 are going to long-term correct that problem. I've heard of some people who had temporary relief. It's known that the corticosteroid injections can last, the pain relief can last up to 3 months. Most people that I talk to, it does not. And in fact, they usually tell me, well, the first time it worked and the second time it didn't. And we try a third time and it didn't work. Or the other way around. The first one didn't work. The second one did. Third one didn't. It's very unreliable whether it's going to help or not. And a lot of that's just for the functional reasons. If you get enough relief that you become more active, those taut bands are still there. And yes, the corticosteroid is keeping the inflammation down so you don't feel the pain as much, but you might actually be increasing the contraction of the muscle by getting back to being more active with muscle fiber dysfunction in the glutes and piriformis. So you could end up maybe creating more of the same problem, and you just don't feel it until the steroid wears off, and then you still have the same problem. So I'll see if I can find. I have my own Gemini AI research report that I generated, and I'm sharing in my Discord group for acupuncturists. But I'll see if I can pull some of the sources and attach them in the copy of this episode. But if you're an acupuncturist and you're in my Podia group, I posted the Discord link so that you can join my new Discord group. I'm leaving Facebook and I'm moving toward Discord. And I did attach that report in a PDF so that people could see it and see the research. Okay, so that is today's episode, and I will talk to you soon. Take care.